Well, good evening, everybody. My name is Steve Kushner. I'm a family medicine physician and past president of the Medical Society of Delaware. One of my initiatives during my tenure as the Medical Society president is the Obvious campaign for kids. Obvious is an acronym for identifying the 7 critical issues that we felt that affected Delaware teens, those being obesity, bullying, violence, making intelligent decisions, which allows us to talk about topics like texting and driving and avoiding vaping and things of that nature, opioid use, underage drinking, and suicide. So the acronym OBVIOUS. So this campaign was designed to address issues with teenagers and our pre-teenagers to create an awareness of the problems that and offer advice and help to address these issues. We're reaching out to both the schools and the general public, and we provide a service and a resource for our community through the Medical Society of Delaware. So thank you for being here tonight to enjoy this important lecture on physical and mental well-being. And we hope you plan to attend the virtual series every Wednesday here in March, starting at 6 o'clock. Our guest speaker this evening is Dr. Alfred Atanda, Jr., the director of the Sports Medicine Program and Pediatric Orthopedic Surgeon and Sports Medicine Specialist at Nemours Children's Hospital. Dr. Atanda serves as the Assistant Professor of Orthopedic Surgery and Pediatrics at Sidney Kimmel Medical College at Thomas Jefferson University. He is a graduate of the University of Pennsylvania School of Medicine, completed an internship in orthopedic surgery residency at the University of Chicago Medical Center, and fellowships in pediatric orthopedic surgery at Nemours Children's and in sports medicine at the Rothman Institute at Thomas Jefferson University. He is certified by the American Board of Orthopedic Surgery. We welcome Dr. Atanda.
Thanks, Dr. Kushner. And everyone else for having me. I really appreciate the time. Thanks for having me. One of the things I like to do as a sports medicine surgeon is really talk about the things that we don't ever really hear about in sports medicine, at least in the clinical sense, as providers, parents, family members, etc. There's a lot of aspects of things that affect our families, specifically our youth athletes and their caregivers, that I wanted to focus on a little bit today. So I don't have any relevant financial disclosures. This is just some brief objectives for the talk. But I usually start out by providing a clinical example. So there was a child, you can see in the upper left is a x-ray of his elbow. He's a football player. He's 15 years old. He broke his elbow, and he broke his medial epicondyle, for those of you that are well-versed at looking at x-rays. But anyway, he got hurt. He left the field. He went to urgent care number 1, where they told him, that he was a kid and they didn't usually treat kids, and he had a big swollen elbow. So they didn't even take an x-ray. And they sent him to urgent care number 2, where he did actually get an x-ray and was told that he has this fracture that you can see, but it's not an emergency room. So they sent him to the ER in Bryn Mawr, Pennsylvania, right outside of Philly. And the residents there are our Jefferson residents who we know very well. And they called me and they say, hey, listen, Dr. Atanda, there's this kid here. He's a child. We don't have pediatric orthopedics, so we have to send it down to you all. So they sent it to us. And for those of you scoring at home, when we see these medial epicondyle fractures, it's actually not an emergency at all. Oftentimes we do treat them surgically, but for this kid, we just sent him home and told him to follow up for an outpatient surgery. So you can imagine all of the other things going through the child's mind and his family's mind. We think of the time, the money, the resources, that were expended. But that's just the tip of the iceberg. He had to go to 4 different medical institutions. The whole time he was in pain. He had certain expectations. He was being told that he has an emergency, that he needs surgery within 24 hours. So all these things are coursing through their mind. Obviously, he's afraid, he's anxious. And then just the myths of what he's heard and read about these injuries, because mom was frantic and she was Googling things. He had a lot of questions. But the biggest thing that I realized from this whole case, and I was kind of involved as the director of sports medicine, but also because they refused to pay, actually. because they had been told all these things at all these other sites, and they get to us and we just send them home, and then of course we build them. And talking to mom, what really broke her down was just all the guilt that she felt. Right, her son was in all this pain. He was uncomfortable. He was crying. He was worried about the future of his football career, etc. And she couldn't really do anything about it. So it just really, made a big impression on me, is the kind of things that our families and kids go through that have nothing to do with their knee pain, their ankle pain, et cetera, et cetera. So I did a lot of research and digging around, and there's a lot of common themes that have come up over the years while being in clinic. And one is this notion and idea of sports specialization. So people feel that, the more you play your sport, the more hours you put in, et cetera, the better you're going to be, especially if you do it early. But there's an extensive amount of literature and research studies out there that show that you don't really want to specialize too soon in anything, because you can see for yourselves on the screen here all the potential risks that come along with it. And the biggest issue is the increased injury risk, right? So the more your child is playing a sport, the earlier they're playing the sport full time, you're not really guaranteeing them any long-term success, and we'll show you that in a few slides. It's really just exposing them to more potential injury. So when we talk about youth sports specialization, you can see if you start at the top with the jersey number 32, we always recommend people play one team at a time. I know the days of, Bo Jackson and Deion Sanders and all these other multi-sport athletes at the real high level are enticing, but that's not the norm anymore. And we definitely don't suggest that for our kids. And as you know, it's very, very common for kids to play on multiple teams at one time, but we do recommend that they focus just on one. So it's hard to go back and forth between their school, between their club, between maybe an Olympic development team or a showcase team. But we, from a medical perspective, we do suggest that they do one at a time to minimize the risk of injury. Also delaying specialization to a time where they're mature. So, girls tend to mature a little bit faster than boys, maybe around 8th or 9th grade, but boys maybe around 11th or 12th grade even, where we don't want them focusing on just one sport. If we look at the number of hours, kind of going in a clockwise direction, the number of hours in a week should be the limit based on their age and how much, their age should be the limit in the number of hours that they play. So as you can see here, if you're 13 years of age, you probably shouldn't play your sport more than that many hours. And that's just a rule of thumb. We obviously want them to have multiple days of rest, if at least 2, if not 3, and have appropriate recovery time. But one of the things that, is very interesting is that the AOSSM put out this statement that you shouldn't really play more than 8 months out of the year of the same organized sport. And that hits home because a lot of kids, they're little, maybe ADHD, a little hyper, and they just need that outlet. So to have them sit around at home for 4 months can be tough for a lot of families. So we don't recommend that they not play sports year round, and we do want them to be doing that, but they just shouldn't be doing the same organized sport. So if they do something for about 8 months, maybe break it up and do a different sport for the other 4 months of the year. And it could be 3 months of this, 1 month of that, 2 months of this, 2 months of that. It doesn't have to be quite so strict and rigid. But the bottom line is we don't want the kids utilizing the same exact musculoskeletal muscle and bone groups throughout the entire year. So I wanted to just show you in terms of early sports specialization. These are a few people that you've probably seen: Strahan, Tim Duncan, Tom Brady, obviously Akeem Olajuwon, Joel Embiid, and Dennis Rodman. The reason I share this with everybody is because majority of these Hall of Fame athletes never played their sport at a high level before their teenage years. Michael Strahan didn't really start focusing on football till 11th grade. Tim Duncan was a swimmer his entire life, and one of the hurricane, it wasn't Katrina, the big hurricane before that, maybe Hurricane Andrew, wiped out his pool in the Caribbean islands, and then he had to start playing basketball when he was like 13 years of age. Tom Brady didn't start till high school. Akeem Olajuwon and Joel Embiid well into their late high school years, and Dennis Rodman, for a lot of you who follow the Bulls closely, I don't even know if he played high level organized basketball even until after high school, when he had a growth spurt and grew like 9 inches. But my point is, a lot of family members, a lot of patients, a lot of people are going to come to you and they're going to say, well, I need my kid playing all the time. I need them starting when they're 3, 4, 5, 6 years of age. Obviously, the guys on this screen, are outliers and are at the top of their games. But the long story short is that it's not necessarily required do the same thing at an elite high level your entire life. It's probably more important just to be active, fit, and have appropriate expectations, which takes us to this next slide. So when you look at the stats, if you look at all of high school kids from this survey almost a decade ago, 94% of them didn't make it to the NCAA level. That means only 6% of all high school athletes in the country at this time that took their survey went on to play in any division, 1, 2, or 3. And that's pretty alarming, because you are going to get a lot of people who you encounter, whether they be patients, whether they be family members, or what have you, who kind of have this notion that they're doing this sport at such a high level and they're pushing themselves to get to that next level, whether it be collegiate or even professional. But the odds are kind of stacked against you, believe it or not, when you're thinking about making that jump from high school to college. And even beyond that, when you're thinking about high school and to the pros, it's 0.04% of high school athletes ever made it to the pro level. But if you look at some of the stats of what kids think about, up to 33% or a third of youth athletes had dreams and aspirations of becoming a professional athlete. So one thing that you want to impress upon people when you're talking to them is that the numbers aren't really in your favor. So if you're doing it solely to win and solely to get to that next level, you may want to think twice, because as we'll see in the subsequent slides, that the true benefit of sports isn't necessarily from winning or competition. It's all the other things that people can benefit from it. So this notion of unstructured free play, so for those of you in your maybe late 30s, 40s, and 50s and beyond, when we were coming up as kids, you'd do your homework real quick and you'd go outside and you play in the street, in the yard, wherever it may be. You'd make up your own rules, you meet people, you pick teams, and then 2 hours later when you're tired, you go home. There were no adults usually influencing things. Obviously, we wanted to win and we wanted to be competitive, but we know that this actually affords kids the best chance of reaping all of the positive benefits of sports and being physically fit and active, but by minimizing a lot of the more negative things, which we'll get at in a few slides. I wanted to say a few words about playing through pain. A lot of people ask, like, my child has pain, or I myself have pain. Is it safe to play through it? What should they do? The good news is that most of the pain, at least that youth athletes experience, is just going to be from overuse. The likelihood that they're going to need anything surgical or big intervention to help with their pain is pretty low. We always want to make sure that their performance is not particularly affected. So if they can play, if they can run around and do what they need to do, but they do have, some soreness or an ailment, if they're playing at the level that they're accustomed to playing at without any difficulty, then it's likely not to be anything too serious. You want to look for physical signs: bruising, redness, limping. That sort of stuff can be a little bit more worrisome, and most of the pain should get better with rest. Obviously, if you're concerned, you want to get evaluated early and often if possible. But the good news about young, healthy, active kids is that despite, having pain and discomfort from time to time, most of it isn't anything that we really need to worry about. Cross training, is it good or bad? This is something that's kind of taken the U.S. and abroad by storm, with CrossFit gyms popping up all over the place. And a lot of people who go to CrossFit have children, and they want to know, should their kids come with them? Should their kids go on their own? If they do some sort of cross training, we want to make sure that it's tailored to the individual child. A lot of the adult CrossFit gyms, it's based on, okay, there's this weight, everybody lifts it 10 times, and then you run to this next station or what have you. That's not necessarily ideal, because, as you know, 2 10-year-olds can be completely different in their size, shape, and structure. So whatever it may be, you want to focus on that particular child. We tend to have people focus more on just body weight as opposed to like trying to max out or see how many reps they can do, etc. And then the goal, again, is to teach discipline and personal accomplishment. So you want to show, okay, you were able to do 10 reps at this weight today. Maybe in 3 days from now, you do 10 reps at a weight that's 2 or 3 pounds heavier, or maybe you do the same amount of weight, but now you can do 20 reps. But the goal is just kind of push them to their limit, not necessarily to beat anybody else, but more so just to show them what they are capable to do in a safe, regimented fashion. And again, we want to minimize the aspect of competition when kids are really young. If you asked me, it would go all the way through high school, but I'd probably be crucified if I said that to a lot of youth athletic clubs in the area. But again, we want our kids to play for the sake of playing and being fit. It's now baseball season for the Phillies fans out there. We have a lot of baseball, softball kids starting up on March 1st. Biggest things we want to talk about to our kids is always minimizing pitch counts, because we know the volume and the amount that kids are throwing. It's much more problematic for overhead throwing athletes, but we see a lot of shoulder pain and biceps tendonitis in our youngsters who are playing softball as well and throw a pitch underhand. We want to make sure that they maintain proper form and technique, especially a lot of those young kids who are 8, 9, 10 years old trying to get on the mound. Throwing something specifically overhead is a very complex motion. And if you're not neurocognitively developed, then you're not going to do it appropriately, which unfortunately can make you susceptible to injuries. And then last but not least, strength and flexibility. A lot of our kids who are going through middle school and puberty and growth spurts, their bodies are getting all out of whack, especially the young females. There's estrogen coursing through their veins, which we know has somewhat of a negative effect on musculoskeletal tissues at times. We want to make sure that these kids can adjust and adapt to the changes in their body. So maintaining a good physical therapy regimen, specifically like hamstring stretching, Achilles strengthening, shoulder range of motion exercises, etc., can be very helpful. So again, just to recount, overuse injuries by and large are caused by 3 issues. 1 is high volumes, 2 is going to be poor form, 3 is going to be poor strength and flexibility. Not pitching and catching in the same game, something that we often preach, because a lot of people say, okay, I'll throw my 40 or 50 pitches or whatever it may be. Then they just go and they play catcher instead, or they go play in the field. We don't, again, at the youth level, a lot of times there's not a lot of kids that can play. So they do repurpose kids and move around after coming off the mound. But think about it, every time that the pitcher throws the ball, the catcher throws it right back. So if you're going to do 2 positions in the same game, definitely do not do pitcher and catcher. Maybe put somebody at first if they really have to play in the field, because there's not a lot of throwing that happens there. And then lastly, kind of delaying curveballs, off-speed pitches. I think a lot of the research that's come out in our sports medicine literature, the pendulum swings from back and forth in terms of when kids should do it. Should they do it at all? I think just delaying it in general is going to be your best bet if you're counseling people. I don't know what 100% the right answer is, because there is a lot of conflicting evidence, but I think you can't go wrong by waiting till folks are skeletally mature. It's obviously a lot easier to see with the boys because they start shaving and have facial hair, et cetera, et cetera. When they get to that level, then it's probably safe. Same with the females. When they start having their menstrual cycles, is probably a rough estimate of when they're getting pretty mature or close to it. Wanted to just say a few words on the challenges of youth sports. Obviously, we know there's a tremendous amount of benefits, but I do want to highlight some of those challenges. As you know, it can be very expensive and cost prohibitive for a lot of families, in other countries, specifically in sports like soccer. If you have the talent, they can get you to where you need to be so that you can play. And if that means taking care of your family, then that's an issue. Not an issue, excuse me. Whereas in this country, it can be a lot different. A lot of times the higher level, more elite teams, you do need money to be a part of that. And the stress of not being able to keep up financially so your child can play as with part of those teams can cause a lot of strain on families. Obviously, we know that there's burnout. We know that kids are kind of being overworked in terms of not just their sport, all of the multitasking and things that they have to do. Sometimes the priorities aren't necessarily aligned. Parents are kind of pushing the kids to play for various reasons that have nothing to do with actually just the enjoyment of the child. So we want to make sure our priorities are in alignment with what we need to do. And of course, that early youth specialization is something that sports specialization is something that we want to avoid. But I think there's way more benefits of youth sports and being physically fit in general. So I do want to focus on some of those things. We like to break them up into physical, psychological, and social benefits. As a physician, obviously know that there's going to be objective markers that we can follow to show some of these benefits. Psychologically, we know that it's improved with substance abuse, depression, anxiety, psychosocial stressors, improvement in self-esteem and academic performance, and just social benefits, right? If you spend a lifetime playing sports and you're around other kids and you know how to solve problems and build relationships and compete when necessary, hold yourselves accountable, all of those skills, excuse me, all of those skills can be used in the future, whether it be in higher education or be in the workplace. Something that I like to talk about is this notion of long-term athlete development. A lot of times, as a sports medicine surgeon and physician, people come to the office, they have knee pain, and they said, "Okay, doc, my knee hurts. I'm having trouble, but I have a game or a big tournament or a big competition or meet in 2 weeks, and I need to be ready for that," because they're very focused on what's right in front of them, and that's kind of how kids think. But it's our jobs as adults to really provide further insight to the kids and get them to see the big picture. So the idea is to be active and fit, and just moving your body for your entire life. It's not about middle school baseball or high school lacrosse or getting that college scholarship or even going to the pros. It's about a continuum, or a journey, if you will. And obviously, some people playing at the elite level, their levels of play at all of these different stages will likely be higher. But the point is, you can see here, I mean, kids shouldn't really be training to compete and win until well into their late teens. And we want to just start, have them learn the fundamentals, just learn to train to do it. And obviously, in your 40s, 50s, 60s, and beyond, we want people just to be active. I think that somehow, some way in the world of youth sports, winning and being the best and getting to the next level is what became the top priority. And that's unfortunately not ideal, especially when kids are pushing their bodies past what their bodies are capable of and having injuries and problems. Resilience is definitely something that we like to talk about as well, because these are life skills that you will learn playing sports at all levels, really. And then also you can call upon these skills in the workplace and in higher education. So it's the ability to withstand the rigors of life. You know that life has its ups and downs and challenges, and resilience isn't about avoiding failure. It's about accepting failure and even leaning into failure, dusting yourself off, getting back up, and doing whatever it is you just failed at again. And having those skills and capability to understand that, okay, teams lose, people get hurt, people have surgery, people get cut from teams. That's okay. And you should really embrace those moments, because if you go through your entire life never failing, then believe it or not, you're never going to really learn how to succeed. And as parents and as care providers, we do a lot to try to protect our kids from quote unquote failure or negative experiences. But we know that if you keep them from those, you're actually going to be doing them more harm than good. As you can see here from this schematic, that we know that there are a tremendous amount of things that are closely intertwined with this idea of resilience. And again, resilience is not never having what you need or what you want, or never being successful. It's about just going through the motions of life and bouncing back when you need to. Last couple of slides here. How do you prevent kids from quitting, right? Because your average kid, if you put them outside in the grass in the warm spring or summer day and give them 9 or 10 of their friends, they're going to run around. They're going to play. They're going to make up games. They're going to make up rules, because kids inherently enjoy these things. But it's all of the external pressure and influence, unfortunately, that a lot of us adults put on youth sports that causes them to then not want to play anymore. When we look at the different reasons why kids quit, often it's not fun. And it's not because, they've played basketball their entire lives, and now that they're 15, they realize that they don't like it. It's not necessarily not fun because they don't like basketball. It's not fun because of all the other things that often go along with that, which is the pressure to perform. They're not playing enough. Maybe it became too competitive. There was too much emphasis on winning. We want to find ways to keep it fun, keep it engaged. We talk about giving players equal playing time, but again, as you get to those higher levels, a lot of the culture and the families and the parents associated with that, they want their kids getting more than other kids based on their performance. And that doesn't really send necessarily the best message at the young age. I think obviously in high school and later in high school, that makes more sense. But doing that to 7, 8, 9 year olds, I think can be kind of tough. So a few things that we can do as parents and as providers who treat some of these kids is to always create a positive environment, understanding that sports can be, tough at times, but you can learn something from all of those tough times and losses and injuries. And we want to be there to support and encourage the child on their particular athletic journey, however good they may be, however not so good they may be, however motivated and focused. It's all about the kids and not on us and the result. Again, you can see focus on the process for those Joel Embiid fans out there. That's something that even a lot of collegiate and professional folks are talking about. And I see you can see in the bottom there again, you want to help your children embrace failure, not necessarily avoid it at all costs, and be a role model to your athlete or child the way that you would like for them to behave. Because with some of these takeaways that you can see here again, a lot of the kids are dropping out because it's no longer fun for them, even though the sport in and of itself may be fun, but the things that go along with it. Always want to remind yourself and your children like why they compete. Remember when you were in first, second, third grade at recess, running around, playing foursquare, dodgeball, flag football, whatever it may be, that joy, that excitement that you had just to be participating, no matter how good you were, or no matter who won or who lost, just that kind of free play. We got to try to bring that back because it's been kind of extinguished and eradicated over the years. And as parents and as adults, if you're happy and you're having fun at these games and competitions, no matter what, your kids are going to likely enjoy themselves too. Again, it's the yelling at the refs and the yelling and fighting at each other in the stands. All of that stuff gets caught up, and it comes a lot from us adults. But you better believe that the kids notice that, and even if they don't say anything, they notice if us as adults, we're not controlling our emotions the way that we can, and showing that stress and anxiety and worry. We're all human. You cannot prevent that. But if you do start feeling that way, maybe just walking off to the side or go sitting in the car, the last thing that you want to do is show that for whatever reason, other than your child's performance and having fun, that you're upset, because it takes away from the kid. And I think as a dad myself, if you didn't learn anything from this talk, if you see a child or your own child or a neighbor's child, and after a game or after a practice, no matter what happened, you go up to them, you tell them that you love them or care about them, you give them a hug, and that you're proud of them, you know? And if you want to then dissect the game and the plays and all that stuff, I think that's fine too, especially sometimes I get a little too critical, but at least the very first thing you should let them know is how wonderful it was to watch them play and have fun. So I'll end there. These are just a couple of references, and I can have Dr. Kushner and others send these out. And then I will stop sharing my screen. Hopefully that worked. And I should be back here too.
Great job, Dr. Atanda. Really appreciate your perspectives given today.
Oh, thank you.
Are there any questions in the audience? Use the chat feature, or if not, let me throw one at you. It's very difficult, I think, Al, to get the parents on the page that you have, and your message is clear today. I think parents do perhaps put a little bit too much stress and pressure on their kids, and teaching them, how do you reach out to these parents? And you're a very busy physician, and you're seeing these patients, these young athletes. Do you pull the parents aside a little bit? Do you see something going on here when their expectations are, get my child back to this sport in 2 weeks because, colleges are looking at them playing in the sport and things like that?
Right. Yeah. I'm not a perfect parent myself. I'm sure I do things and say things to my kids that aren't ideal. I'm not here to judge anybody, but I just try to reframe whatever problem or issue they have to get them to see it in that mindset of that long-term athletic development. It's get them to see the big picture. I try to get them to think about their personal goals, right? So if you're a child and you're in ninth grade and you have a goal of maybe one day playing in college, basketball, football, whatever it may be, you come into me with an injury. Everything at that moment should be to try to get you to that goal. It's not necessarily, oh, I have this tournament in 3 days or I have this showcase in a month. It's, I need to be healthy and fit to play at the top of my particular performance level such that I can keep moving to get to whatever goal I've set for myself. And if that means missing a month or two now, such that 3 years from now I'm perfectly fine, then I think that's a worthwhile trade-off. So I usually try to frame it like that. And even pretty much most sound normal people, that'll resonate with them a little bit and get them at least to take their foot off the gas. But it's hard. And as we know, this is our youth sports culture. Like I said, in the last 30, 40 years, everything has completely changed. And as you know, culture eats strategy for breakfast, lunch, and dinner. I mean, it's hard to change culture, but I try to do it one person at a time. I do, these sorts of things once or twice a month. I've done podcast webinars to put some passive information out there, but it's really a grassroots effort because you're going up against a $10 billion a year business.
True said. A question came in. The key to longevity, I'm believing, is movement at any age, especially as you get a little older. When is it too early to start a child to kind of like, quote, working out or getting them active? Is there, I see them
Yeah.
trying to pump muscles at an early age, and I'm thinking that doesn't seem right.
So definitely before puberty, guys and girls, we don't want them lifting like heavy weights. I technically recommend body weight. So we have them do push-ups, pull-ups, climb the rope in gym class, sit-ups, run. And then obviously, they can play, sports at a younger age too, but we don't want like formal training and pumping iron and all of that, only because before you're skeletally mature and physiologically mature, you're not really, especially for the guys, you're not really going to be able to change that weight into muscle anyway. It's just going, if you're 11 and you do 4,000 push-ups a day, you're not going to become like this big, huge hulking kid. So you're just exposing yourself to more risk if you do it too young. That's the point. So for lifting and heavy stuff, usually after maturity, and then just being active. I mean, even if they're 5 and you want to play a little game in the back, little t-ball, little wiffle ball, having them run around and do anything is fine as long as it's not pushing them too far and it's them that's kind of driving the bus. If they're 5, 6 years old, I mean, you don't want to be yelling at first graders, to keep running laps. So it just should be fun and kind of whatever the kids are looking for at that young of an age.
Got another question from the
Yeah.
audience. The traveling teams that one sport all the way through, are you discouraging that, or are you just saying, hey, mix it up with other things, uh, keep it interesting, but don't focus so much effort into that. Kind of break it up, like you started to say about free play and unstructured play is also really important to incorporate into their athletic careers.
Right. Yeah. I would say first and foremost, all the things that I showed that have the benefits of sports have nothing to do with winning or competing for the most part, or at least intense competition. If you keep score, that's always fine. So the true benefit isn't because they're playing in Arkansas or California or down the road. It's because they're playing. So the travel aspect of it, that just benefits the people that are making money. It doesn't really benefit the child per se. So if they are going to be doing those sorts of kind of higher level things that are really organized and really regimented, I mean, some people want to do that. I think keeping it to about an 8-month maximum throughout the year per sport, right? So if they play soccer and that's their thing, maybe play soccer for 8, 9 months, and then 3 months out of the year, just train on your own, just ride your bike, go to the gym, or play a different sport, play basketball or whatever. Just, I mean, because some kids just have to be active all the time and we don't want to take that from them. So maybe just mix it up a little bit. But to be honest with you, um, travel sports is the norm. Um, but it doesn't really add anything to your overall child's physical fitness. Obviously, if you're trying to get them looked at and all this stuff, then there's certain clubs you got to be a part of. But if it's just raw, pure physical and psychological and social fitness, regular 3 to 4 day a week, $20 rec soccer is probably just fine.
So true. One last, you led off the questions or your talk with the emergency room issue, where
Yeah.
when seen at one place, then to another. That is there any way of getting around that? Because boy, that is frustrating for my patients. I know because everyone doesn't want to go to an emergency room, and they end up there,
Right.
and they end up being transferred around. I don't know, maybe better communication between.
Well, before
You do.
long story short, that particular story sparked a whole 3 year project for me to figure out why kids were being transferred to our hospital if they didn't need to be. So long story short, as you know, when people have injuries, they tend to go to the emergency room, urgent care, or their PCP's office because those places are open and accessible to them, and they're in their towns and they know them, and it's next to Costco and Wegmans and this and that. They don't know where I am, and I don't work after 4:30 and on the weekends that's when all the kids are running around playing sports. So they go to those places because they don't really have a lot of choices. The fact that they bounce from place to place to place, that's a problem with the vast, digital healthcare landscape of the American healthcare ecosystem, which I'm quite passionate about in digital transformation at Nemours. So I actually spend 70% of my time doing that as opposed to actual orthopedic surgery. So doctors don't have ways of talking to each other, right? So when they go from one institution to the next institution, they have no idea why you're there. God forbid they send you with a disc with x-rays on it and they can't open it and this and that, or they don't have the report. It's a whole host of problems that mostly have to do with the organizational systems level, but they really just affect everyday people who are just trying to get their kids evaluated. They just, all the privacy and risk and HIPAA and all this stuff, I mean, it just makes people's lives harder, whether it be the patients, whether it be us as providers. I do understand that it needs to be there, and I understand why those safeguards are there, but ultimately navigating the healthcare ecosystem in this country, even though it's like the most important thing to an individual, it's literally the hardest thing to do. And people dread it. And there's all sorts of war stories and problems. And it's a miracle that we take care of anybody because, as you all know, it's very chaotic and efficient. And then you add all the issues with youth sports and the kids always getting hurt. It's just a lot of frustration and anxiety that good, well-natured people and children do not need in their lives.
Amen to that. Well, thank you so much for joining us tonight and sharing your perspectives. Dr. Atanda, excellent presentation. And so we thank you very much for being a part of this obvious campaign.
Yeah. Well, thank you, everybody. I appreciate your time. Everybody stay safe, stay dry, and have a great week.
Very good. For all of us, please spread the word about the Obvious March series every Wednesday in March, starting at 6 o'clock. To register, visit the Medical Society of Delaware's website, click on the Obvious flyer. And if you've already registered, good for you. If you haven't, see if you can tag a friend or two to come on board and join us. Next Wednesday, the 12th, we have an address on emotional intelligence and conflict resolution presented by Ty Randolph, the youth program manager at the YMCA of Delaware. So thank you, Anjay, and thank you, Lynn, for joining us in putting this together. We hope to see you all next week, next Wednesday. Thanks, everybody. Thanks for joining us. Have a great night and be safe.
Bye, Dad. Goodbye.